In the last several weeks, you've received a number of emails from me concerning changes in the Medicaid program in a number of states. These changes will allow the states to shift more to a managed care model of service delivery for Medicaid patients, and in the process will have dramatic effects upon the transportation benefit in Medicaid and how we look at coordination in places where managed care will be applied. Some would say that these changes are in and of themselves negative because they will create change. I, on the other hand, believe that these changes may have beneficial responses for both Medicaid recipients and also simplify, in some respects, our ability to initiate coordinated activities at the local level. As you know from my forwarding of the Texas story, I have been concerned for a great number of years about the way we provide Medicaid services in Texas. Texas is a state still using a fee-for-service approach to Medicaid, which causes the burden of finding doctors to be placed upon patients. In the case of patients who need specialty care, such as parents looking for special pediatric care for children, it is often impossible for them to find a local qualified physician participating in the Medicaid program to provide their health services. Consequently, they are forced to drive great distances or request services at a great distance that are both financially inefficient and require long distances and time and space that make the trip less comfortable for a sick child or a sick individual for that matter, or often taking an entire day. This is difficult since many of the people who are on Medicaid today are also working people. Managed care offers the states the ability to create a closer network of service in the communities where people live. So it is my hope, if this managed care options are initiated correctly, we will see a lot less long-distance trips. In the article we did last week in Community Transportation on dialysis, we also mentioned the need to coordinate when many people who obtain their dialysis service might in fact be able to get there on a bus, but they often need individualized transportation for the return trip. This means to me the ability to work between organizations that provide bus service and specific taxi-like service should increase. We are rapidly moving in these waivers to a system that is designed and targeted on the individual needs of patients as opposed to group needs. The solution to make that work with transportation is to expand the concepts and integration locally. We've known from the very beginning, from the first efforts on the framework for action, that one of the solutions to good coordination at the local level is good cooperation between taxi companies and public transit. And many times when we've discussed coordination, it tends to be all about what government programs can do, but in this case, as the government devolves so much of its responsibility to the private sector in these managed care organizations, it's much more important that we figure out how to work together at the local level to make coordination possible. So to me, these changes, which again some people view as negative, I view as an opportunity for you to take your message to the communities that we want to serve and to local people to say, by working together, whether we're a government organization or a private one or a volunteer one, we can create a more responsive, coordinated transportation system in our community that serves people today and will serve people tomorrow. In some respects, much of what we've learned over the last several years can be applied at the local and community level, and I suspect that people will be looking for new ways to make the systems more seamless and more accessible in local communities. Other things that we've been involved with, and you, in technology, will also provide a significant benefit to these issues as they develop. The other issue that I'm concerned with, besides other changes that we usually talk about, is that transit and community services at the local level have to be made more affordable. One of the real crises that we face is that a large number of seniors, as you know, no longer qualify for some specific government program. As we know, the Older Americans Act, which at one time boasted its ability to serve all older Americans, is nowhere near capable of that. And until we get a balanced approach in Medicare that provides non-emergency transportation, people and individuals are forced to struggle to provide their own transportation. I think by working together on a coordinated effort in local communities, we can have an impact to create more reasonably priced systems for everyone. The reason I bring that up today is that as we approach the end of the year, I know that much of the information and discussion that has taken place this year here in Washington, that has seeped out to the nation, has been extremely negative. And I also know that people are very worried and very concerned about the political trends here that seem to be geared toward doing less and providing less help to local communities. We know that none of that will solve the problem, but we do know that that should create more ideas and desire for coordination at the local level. So as we approach the end of this year, I wanted you to know from me that the work that you do as an ambassador in facilitating that kind of discussion and coordination at all levels is very important and will become more important every day starting next year when we implement these waivers across the country. There will be a higher demand for coordination than we've ever seen, and it will include a different approach in some cases, but the same principles that we've been working on since the Ambassador Program and the NRC was founded. So your work has been very important to date. Your work in the future will be even more important because there will be greater demand for the information, history, and experience that you have in helping people develop common sense solutions to their mobility needs. So I wanted to end this year by telling you that I think, as difficult as this has been over the last several years, there is room for change, and change will create new opportunities. I know it's very hard for some people to accept the fact that change is good under any circumstances, but considering our situation in trying to deal with a number of transportation crises, I believe that change ought to be, as President Clinton used to say, our friend. So again, I want to wish you a very happy holiday. I want to thank you for your great service to our efforts together, to our association, the state and community partners that you work with. And I want you to feel that you will have our full support in trying to extend our concepts even further in the year that lies ahead. Thanks again for all your help, and have a very nice holiday, and I look forward to seeing you in the new year as we begin to continue the important work in which we've been engaged since we first created the first ambassadorship, and we continue that fight every single day next year. Thanks, bye for now, and I hope to see you soon.